I guess I'll just talk my way through the intro here. So this is welcome to the third WESTalks series seminar. WESTalks is collaboratively hosted by IC Impacts and UBC Future Waters. So yeah, IC Impacts is the India-Canada collaboration. It's the Pan-Canadian Canada-India Research Center of Excellence, which serves as a new model for international collaboration, co-developing research solutions to solve global challenges. And it's been hosted here at UBC for the last 7 years. On the other side, Future Waters is a new research cluster within UBC. So it's a UBC Research Excellence Center, and it focuses on the future states of water. It is focusing on the interdisciplinary research at the intersection of law, policy, and governance, and the applied and biophysical sciences. So the organizing committee for these WESTalks series is Abhishek, who you can see there, who's a PhD candidate here at UBC, Jaskaran, who's a postdoc at McGill, Fuhar, who is also a PhD candidate here at UBC, and then myself, Carl, and I'm a PhD student at UBC as well. Here's the lineup, which I guess I wish I could share this screen with you. Anyways, we're into week 3 here. So Dr. Patrick Mirindi is going to be giving this week's presentation. Next week, we have Dr. Mike McKee from U of T talking about biofiltration. August 7th, we have Dr. Paul Westeroff of Arizona State University, and that's part of the SEC keynote for that day. August 13th, anyway, you know, this might be easier to email out rather than me reading off the list. So with that, we'll get to today's speaker, Dr. Patrick Mirindi. So Dr. Patrick Mirindi is a medical doctor trained in international health and community medicine from HUGI in Israel and in epidemiology from Ghent University in Belgium. Over time, he has specialized in the control of diseases and environmental health. Dr. Mirindi was recently involved in the Ebola outbreak response in the DR Congo as a part of the WHO Infection Prevention and Control, as well as in the COVID-19 response with WHO's Health Information and Risk Assessment Regional Office. He's also worked on several humanitarian responses to health disasters, such as in Haiti and in the Congo, with international organizations such as Tufts University, Johns Hopkins, Edinburgh, and Ghent University, to name a few. Dr. Mirindi works towards evidence-based interventions, which has led to his interest in water, sanitation, and hygiene, and infection prevention and control research to support high-quality health, sustainable interventions, and health policy. So with that, I'd like to hand it over to Dr. Mirindi. So I don't know if maybe he can start sharing screen. And thanks again, Dr. Mirindi, for giving today's talk. So again, the format, as always, we'll go through the presentation. It'll be about 25, 30 minutes. And then we'll have 15 minutes for questions at the end. So if anybody has any questions, feel free to put them in the chat, or I think there's a question and answer box, and then we'll be monitoring those at the end of the presentation. Fantastic. Patrick, take it away.
Okay, so hope I'm clear right now. Raise a hand if you can hear me. Okay, so today's presentation is, it will be more a discussion, and it will be involving challenges around waterborne diseases in developing countries, and we'll try to focus on the case of cholera in DRC and what are the challenges which are coming in the near future. So moving on, so we know the outline, the objective. So these challenges, we'll see waterborne, and we'll see a short presentation on DRC. As I mentioned, it will be more about a discussion. So it won't be a kind of research-oriented or very in-depth overview of the challenges. So overall, we know that there is humanitarian emergency, natural disaster, conflict, disease outbreak, which are occurring all over the world. And now the rate of these occurrence is going at faster than before. And worldwide, we know people are lacking access, and 1 billion people lack access to improved water sources, and 2.4 billion have no basic sanitation. So worldwide, it's an estimate 1 out of 3 people do not have access to safe water for drinking. 2 out of 5 do not have also access to hand washing facilities and soap, well, with soap and water. And then we still have around 700 million people who still practice all these. So when we put all these together, we know that these waterborne diseases are here to be addressed as one of the major issues. And diarrhea due to infection is also widespread in developing countries. So this context is one of the major key in this presentation. So most of developing countries, communities are in South Asia and Africa. And we know like roughly all deaths are around 7 to 8% of death in those areas are due to diarrheas. And those diarrheas are related to water access, safe water access, safe drinking water access. So we know on one hand, we have the problem. We know the problem of diarrhea is related to water. And we have more and more humanitarian response which have been implemented and funding have been raised, but the gap between the need and the fund is also increasing. And when we need now to prioritize where do we have to drive our fundings, we have to see where the need to be the more, let's say, impactful. And that's how the UN, as you know, all of us, we know that the UN came up with these SDGs, and all the SDGs, the 6 SDGs emphasize on access, universal access to safe drinking water and sanitation, and then improve all the quality and reduce pollution and impact on all the ecosystem around water. But the problem of water is not only water issue, it's also around all the other dimensions, which regarding developing countries, you know, poverty, health, education, cities which are growing, and pollution of reserve. Here, you know, ocean, lakes, and your water ecosystem. So it's important to understand that water is not only an issue of safe drinking water or sanitation. To try to alleviate the challenges around this, we need to see globally and other dimensions. So for waterborne disease, I won't go deep into this. And why I chose to talk a little bit about cholera is one of the major, one common humanitarian emergencies in these marginalized countries now, especially in Africa, is cholera. It has been there for a long time. I think at least for some countries since 60s, they have this problem. And up to today in 2020, many countries are still facing this humanitarian emergency. So we know we have lake, pond, river, which are our main source of water. But all these, the agent of waterborne diseases are also hosted in those water reserve. And the reservoir for many of these waterborne diseases is mostly human and animals, and few are only in humans. And the transmission is more likely mostly explained by little or no access to safe water and other practice around sanitation. So let's say a brief presentation about DRC. I'll be quick. And so the DRC is one of the biggest country in Africa, so the second after Algeria. And if you see DRC by itself, you see 3.3% of it is water. So saying the source of water, like the reservoir, the country has a lot of water. But Actually, now, as of today, we know there is outbreaks, and one of the outbreak which is active right now, it's cholera. And when you link all these outbreaks, they are around hygiene and water access. And you can also relate to the way people are still sanitation, the access to sanitation, which is very, which is still very low. So I would like to just present one of the facts and we'll try to discuss about this graph a little bit. So the cholera in DRC, the first case was introduced in 1974. And then the worst 20 years later, we had in the country had 55,000 deaths, which was around refugee camps, people flying, which came from Rwanda, from trying to escape from the genocide, which was there. And when they got in DRC, unfortunately, in the camp, they were struck by Ebola, sorry, by cholera, sorry. Then, since then, what could have been the solution was turned into a seasonal disease. And if you see the first graph on the top, all right, you see the disease has tendency to have spikes, and over years, around April to July, April, July, August, there is a decrease and then it spikes again. And over time, there were being big program, and even in 2013, a big program tried to stop the disease. It failed, and then I think you will see later what's happened is cases are now increasing over time. 2017, it's double into the numbers, and 2018, 19, and 20, the numbers still growing. So the disease is turned into a seasonal disease, that's one side, and the other side, there is population migration and armed conflict, which also impacted on the way the disease is affecting people. And if you see in the graph on the bottom, you'll see three things. The first curve is the number of cases of cholera over time. And the second in the middle is army conflict. And the third is migration. So you would see there is a correlation between the three. When there is migrations, there is also spikes of cholera. These cholera cases will mostly occur around the same places where we found water reservoir. And if you remember the first graph, which I'll come back later, you'll see that all the blue cases which are appearing in this graph, I don't know if I can point onto this, pointer option. So all the dark blue cases are the new area which are affected by cholera in the country. But at the beginning, the first cases were only in this area, the east, and it was manageable. So we know how it's transmitted. The country went from only one area, which was active with cholera, to having half of the country having cholera, from the north to the south, from the east of the country to the west of the country. And now cholera has become endemic to this area. And we know this area have poor access to drinking water, poor hygiene, and poor access to latrines. So this is now the map of the country. And we can relate to this and ask ourselves, what's happened during that period? Why we didn't manage to stop it or control it while it was only in one region? And now we have it widespread in the country. And what are the challenges? So the first challenges which we can think about is rapid population growth. And this is in all developing countries. the problem of population growth and also migration toward water sources has one consequences is services which didn't take time to scale up to respond to these new needs, like new community member coming and have to share. Let's say you have a village and have one improved water source, and it was maybe for 300 people. And now, due to wars where people are not, uh, do not have access to the traditional land, they come in new villages and they install themselves and they have to share the same water sources. So the survey didn't scale up, and the same with community sanitation. Then there is no surveillance, environmental surveillance, and one of the consequences is water pollution. So lake, river, and other reservoir are now contaminated, as there is no way the country, there is no strong political, let's say, involvement into surveillance of water resources. People tend to use it the way they want. There is some part of the country where they use pits to get water and they contaminate the underground reservoirs in those areas, and it makes them relying too much to sources of water which are more expensive go to go for. And then the poor coordination of intervention into the country. There is many partners, and they don't really integrate what they are doing around water, around improving water. There is technology, there is knowledge, science has evolved, but there is inadequate intervention. There is most of the time you'll hear about bucket chlorination because it's an emergency. Water tracking, yes, it's an emergency. Or now they want to use plastic containers. And what this turned to is people get used to this. And bucket chlorination, which is an emergency solution, is now permanent in some areas. In some villages, it's normal to see people on the line, even without an outbreak, with or without an outbreak. They are lining themselves to get bucket of water and then get some milliliter of chlorine solution for disinfection. So this is one of the problem, one of the challenges. How do we get out this emergency mindset and go for a development or sustainable solution, which can be scale up and be easy to apply. Let's say, for example, if we go for water tracking, for example, in a city like Goma, where there were these, it's a city which got everything, disaster. There was a volcano, there were wars, there were cholera outbreaks there, and then they're on the lake. The problem there, up to today, 20 years after the major uh, earthquake and then the volcano, they're still using bucket chlorination and water tracking, and it's become a business where public-private are relying on this. So changing this is one of the challenge because there is a business already around this system. And then the use of single container plastic, reusable bottle of water. And we know not everybody has a sanitation system where they collect trash or reusable bottles. So these are everywhere now, and they are polluting the lakes and other source of water. So when we have polluted the reservoir, we turn to expensive decontamination processes and the need for new sources for community, which are sometimes far from the settlements. And this makes it more expensive or time consuming for households to just fetch water and let's say collect and get water to the families. And one of the problem which is the challenge which is getting around water is many partners, many funding organizations are losing interest toward waterborne diseases. So fundings can go downstream. Like people are not willing to fund. Even cholera is not anymore a major issue for many, and they think as when it spikes, people can get involved. As it's become an endemic problem, let's say in the case of a country like DRC, nobody wants to put his feet into it. I remember being in a bigger meeting with many organizations, and one of the target of one organization, which I don't want to mention, was to give people access to water in villages. And in this big program, the escape for the organization was, yes, our objective, our output was to give people access to water, but the objective didn't say to give people access to safe drinking water. So with that in mind, they can just do whatever they want and can justify why there's still a problem in villages where they're intervening. And then climate change, lack of preparedness, and then desertification or water scarcity in some area can put people to use some other technique, irrigation, which can modify the regional distribution of parasites and impact on exposure and disease. I think you can link that to the problem of a country like South Sudan, which has conflict with other countries like Egypt and even Sudan, toward they want to deviate the water from the Nile River into the country. And this may be a problem for other country on the other side of the river. So there is a major problem into this climate change, and there we can foresee other problems, even disease distribution will change from country to country. So we have to keep in mind, like, water is more and more polluted, and it will require expensive decontamination process in developing country. If you go, let's say you do reverse osmosis, you'll need energy for that. And when you put that in place, nobody will afford the system, and developing communities, like marginalized community, won't be able to afford the water you'll be bringing to them. And when you go, the farthest you go to fetch water for a community, the more expensive and time consuming it will be. So these marginalized population are now relying, and still relying on untreated water. And 93% of community relying on untreated water live in rural areas, which is also a major challenge because cities are getting the same problem at a higher rate than rural areas. So the energy and all the resources are driven toward cities as much as possible. And those rural areas are not getting so much attention in terms of water access. So this is also a challenge between the rural and the urban areas in terms of water access. And then there is rural areas where people do not have access to sanitation. And open defecation is known to be one of the major issues for water contamination. So poor hand hygiene, poor maintenance, this is something people are getting on it. And you can see, for example, for poor maintenance, when you put in a village, let's say there is an island where they put these pits and they put a motor pump, which was a gasoline based generator or pump, water pump, which was supplying water for the island. But this is gas based, so it needs uh, continuous, uh, first continuous supply of gas, and then the generator and the system need maintenance. And when you have a village where there is no one after the intervention who can maintain this infrastructure, this can be a challenge in the future because everyone thinks yes, there is a partner who puts a generator, a pump in that area, but if the community is not able to maintain it, it's getting difficult for them to maintain access to water. So, and then finally, or let's say two things is the weak capacity of countries to implement, or even at local level to implement water safety plans. And this is one of the major issues around water. Even in area where they manage to put networks, there is a kind of, let's say, water is power in a village. Those who have access to water can challenge others, especially those who are weaker or don't have this kind of means to leverage toward them. And when there is not a strong plan for all the community members, you find out some are even in those marginalized rural population, they are even marginalized community or even marginalized households to get access to safety water. So intervention, there is many, but I will just be short on this. We have to remember the holistic intervention around water, and we have to remember poverty. We need to run against health, education, how cities are evolving, ocean and ecosystem. And one of the major things which I always want people to now thinking is, even if it's an emergency intervention, how our intervention can be a solution for a long term. Because in emergency situation, we just postpone the problem. We just say, okay, people need access to drinking water, but we don't say, okay, the solution I'm putting in place, yes, it's an emergency solution. It's easy to implement. Let's say bucket chlorination, it's easy to implement. Any organization can do it in maybe in one day, they can put in place a system. But do we solve the problem for that community on the long run? That's a question, and that's one of the challenge. And even intervention should always keep that in mind. So, conclusion. So we always have to keep in mind that temporary solution can last longer in community as people adapt to it, and the environment where we are creating make them feeling safe to look for another solution. When a city is running water tracking for 10 years, you have to ask yourself, why are they doing this? It's expensive, it's gas, who's paying for that? And if there's people who can pay for water tracking, why don't they pay for a network? Or what can be the solution for easy networking for that area? And then outbreak, it's always demonstration of breakdown or failure, but it's always an opportunity to readjust our way of responding to disease and maybe improve the system. So this is more or less the basic. We need to keep in mind that funding are increasing, but problem also are increasing. And increasing, at crisis increase, the funding and intervention will not match the needs. So basically, that's what I had to say. Thank you, and over to Carl maybe to point out if I missed something.